Welcome to the Dental Compare Buyer's Guide on Operatory Lighting. Now, before you choose an operatory light, there's a couple basic things about lighting you need to know. Think about a traditional bulb. It has a glass casing and a tungsten filament inside that. You pass current through it, it releases energy in the form of light. Eventually that tungsten filament degrades and the light bulb needs to be replaced. Halogen bulbs aren't too much different, except they're smaller, they're in a quartz casing, and there's a halogen gas of some kind on the inside that helps prevent degradation of the tungsten filament, which means you could pump a lot more power through it, it's a lot brighter. We see halogen bulbs in our traditional operatory lights, we see halogen bulbs in our curing lights. Well, new on the market for dentistry now is LED lighting, light emitting diode. So rather than having a filament, you just have a block of material that releases this light. So why is it better? Well, it's less heat than traditional halogen lighting. It also requires less power. There's also nothing to basically break down, so they just last forever. Now, one of the things about an LED light is that it goes at a particular wavelength. So one of the things to be aware of when choosing an LED light is what wavelength does this particular light actually project. You want to pick one that has lighting that's very similar in color temperature to daylight. Think about when you're color matching or shade matching chairside, you don't want something that's skewed so when the patient walks out the door they look a lot different. So another reason wavelength is important besides shade matching is that you have the opportunity to shut off certain wavelengths. So we call that cure safe mode, where you can turn off the particular wavelengths that are going to cure your material. So why is that important? Well, now, unlike a regular light, halogen light, you can have the light on the entire time you're doing your bonding procedure. So say you're doing veneers across the front and you're worried about the resin setting up, now you can just leave the light on in cure safe mode and still have great illumination. Other things to think about when picking an operatory light, think about the color pattern that comes out. You want it to be crisp and concise. You don't want it basically bleeding out on the edges where it's going to get in the patient's eyes, for example. You also want to think about what your operatory looks like. Think about what mounting options are available to you. Can you put it on the wall, on the chair, on the ceiling? And most importantly too, it might be the best light in the world, but if it's not compatible with your chair, you need to know that up front. Is this new light going to be backwards compatible with what I already have? So for more information, check out the Buyer's Guide on Dental Compare for operatory lighting.